Hello, my name is Jacqueline Aguilar. I'm a GCU student, and today I'm going to be talking about cybersecurity framework for Augusta Medical Hospital. Augusta Medical Health opened in 1994 to continue a tradition of personalized care with small-town hospitality. For healthcare organizations, implementing robust protections for sensitive data is essential to provide the best patient care and to prevent cybercriminals from accessing your sensitive information. Taking proactive steps to prevent data breaches to maintain adequate healthcare cybersecurity can allow you to avoid many common cyber threats and can allow you to stay in compliance with all federal, state, and local regulations regarding cybersecurity in the healthcare environment. A compromised system can delay or misinform treatments, posing grave risks. For instance, if a hospital electronic health record system is attacked, clinicians might be unable to access critical patient data, leading to potential misdiagnosis or inappropriate treatments. Consequences of data breaches result in financial loss, legal consequences, reputational damage, identity theft and fraud, loss of intellectual property, operational disruption, increased cyber insurance premiums and regulatory compliance issues, and loss of trust. In the following slides, we're going to talk about a 2017 cyber attack on Augusta Medical Hospital, and we're going to talk about the alignment with NICT Cybersecurity Framework. Hackers targeted the university's health system with phishing emails on September 2017. Hackers accessed data on around 417,000 patients. Hackers solicited usernames and passwords, giving them access to a number of internal email accounts. The breached data included demographic information, medical record numbers, medical data, treatment information, surgical details, diagnosis, medication, dates on services, and/or insurance information. Hackers commonly use this type of data for medical fraud. Upon discovery of the breach, access to the email accounts were disabled and passwords were reset. The investigation concluded on July 18, 2017, that an unauthorized third-party accessed medical faulty email accounts containing patient-protected health information or personal information, but could not definitely conclude if any information was actually accessed, viewed, downloaded, or otherwise acquired by the unauthorized user. This is not the first time that employees at Augusta University have fallen for phishing scams. A similar breach occurred between September 7th through the 9th in 2016, resulting in similar data being exposed. In that case, a small number of employees responded to phishing emails and divulged their email logins. Individuals impacted by the breach were notified within 60 days of the breach investigation being completed. The breach was reported to the HHS Office for Civil Rights on May 26, 2017. In response to the attack, officials hired new leadership to fill roles in a number of critical departments. Augusta Health University has implemented multi-factor authentication for off-campus emails while reviewing tools to limit email retention. Officials are also banning protected health data being sent in emails. NICT Cybersecurity Framework Overview is a set of guidelines and best practices that help organizations manage and improve their cybersecurity. It offers a taxonomy of high-level cybersecurity outcomes that can be used by any organization, regardless of its size, sector, or maturity, to better understand, assess, prioritize, and communicate its cybersecurity efforts. The framework can be applied in 5 areas, and the first one being identify. Make a list of all equipment, software, and data and create a cybersecurity policy. The organization's current cybersecurity risks are understood. Assets that enable the organization to achieve business purposes are identified and managed consistent with their relative importance to organizational objectives and the organization's risk strategy. Inventories of hardware managed by the organization or maintained. Inventories of software services and systems managed by the organization are also maintained. Under Protect, safeguards to manage the organization's cybersecurity risks are used. Access to physical and logical assets is limited to authorized users, services, and hardware, and managed commensurate with the assessed risk of unauthorized access. It identifies credentials for authorized users, services, and hardware are managed by the organizations. Identities are proved and bound to credentials based on the context of interactions. Users, services, and hardwares are authenticated. Identity assertions are protected, conveyed, and verified. Under Detect, possible cybersecurity attacks and compromises are found and analyzed. Assets are monitored to find anomalies, indicators of compromise, and other potentially adverse events. Networks and network services are monitored to find potentially adverse events. Under Response, actions regarding a detected cybersecurity incident are taken. Responses to detected cybersecurity incidents are managed. The incident response plan is executed in coordination with relevant third parties once an incident is declared. Incident reports are triaged and validated. Incidents are categorized and prioritized. Incidents are escalated or elevated as needed. Under Recover, assets and operations affected by cybersecurity incidents are restored. Restoration activities are performed to ensure operational availability of systems and services affected by cybersecurity incidents. Recovery actions are selected, scoped, prioritized, and performed. The integrity of backups and other restoration assets is verified before using them for restoration. Key assets of Augusta Medical Hospital includes employee personal information, operational systems such as imaging, lab results, medical records, and network infrastructure. A data breach compromises all of the mentioned information. Applicable regulatory requirements. Augusta Medical Health is required to abide by HIPAA requirements. HIPAA aims to protect sensitive patient data by setting standards for how healthcare providers store, access, and transmit electronic health information. Healthcare providers must comply with HIPAA regulations by performing risk assessments, implementing security measures, and training staff on data protection practices. This rule mandates that covered entities like hospitals and healthcare plans implement reasonable safeguards to prevent unauthorized access, disclosure, alteration, or destruction of PHI. HIPAA violations included proper disposal of personal health information, failing to securely dispose of protected health information so that unauthorized people can access this. This includes forgetting to shred a form or delete a file. HITECH Act Health Information Technology for Economic and Clinical Health is an amendment to HIPAA which further emphasizes the protection of electronic healthcare records and includes stricter regulations for data breaches. Quality System Regulation is a set of requirements from the FDA that manufacturers of medical devices must follow to ensure their products are safe and effective. Manufacturers must establish and maintain procedures to control and verify the design of their devices. The FDA can take enforcement actions against manufacturers who are not complying with the QSR. False Claim Acts can be used by the Department of Justice to prosecute healthcare providers for cybersecurity-related fraud if they fail to adequately protect patient data. Examples of FCA violations include a hospital billing Medicare for extended patient stay that didn't happen, failing to return overpayments to the government, or buying public property from a government employee. A threat landscape analysis for hospitals identifies the primary cyber threats that could target a healthcare facility. External threats include hackers, viruses, malware, phishing attacks, and ransomware. Internal threats include malicious insiders, accidental errors, weak passwords, and lack of training on cybersecurity policies. Specific threats targeting healthcare sectors include medical device vulnerabilities and supply chain attacks. The following is an example of a vulnerability scan conducted. As you can see the critical severity, high severity, medium severity, and low severity, and the amount of vulnerabilities within each category. On the following screenshot, you can see that 286 were unique critical severity vulnerabilities. You could find the type of vulnerability, the description, and then it provides a solution, which often are patch upgrades that can be completed in order to fix the vulnerability and have a more secure system. A vulnerability assessment aims to uncover vulnerabilities in a network and recommends the appropriate mitigation or remediation to reduce or remove the risk. There are 8 steps to performing a vulnerability assessment, which includes conducting risk identification and analysis, developing vulnerability scanning policies and procedures, identifying the type of vulnerability scan, configuring the scan, performing the scan, evaluating risks, interpreting the scan results, and creating a remediation and mitigation plan. A security expert conducts vulnerability analysis of the network scans to prioritize threats identified. From this, an action plan can be created with steps to remediate vulnerabilities. For example, maintaining up-to-date patches and implementing a patch management procedure may be a valid recommendation. Identifying risks for each asset and possible threats they face is a complex task. The most important thing is to structure the process well so that nothing important slips through the cracks. Companies can accomplish this by structuring their assets with added columns for threats and vulnerabilities. After you assign threats and vulnerabilities to your assets, you can begin the analysis phase where you assign risks to assets by determining the impact and likelihood of each threat materializing. To have a structured and successful scanning methodology, policies and procedures must exist in order to have a predetermined course of action needed to be taken. The most important factors are the type of scans that will be conducted, the way the scans will be performed, and software solutions used. Vulnerability scanning is a process where vulnerability scanning software is used to identify security weaknesses in information systems. Vulnerability scanning can be performed by network administrators, information security analysts, and all technical IT staff that are trained and assigned with the function of conducting a vulnerability scan. Depending on the software that is running on the system, you need to scan and secure and need to determine the type of scan to be performed in order to get the most benefits. Even though there are many vulnerability scanning vendors to choose from, the configuration of any scan can be addressed. This is done by identifying general objectives and type of system you want to scan. To configure a vulnerability scan, you must add a list of targeted IPs, define port range and protocols, define the targets, and set up the aggressiveness of the scan, time, and notifications. After determining the type of scan you want to conduct, and after setting up the configuration of the scan, you can save the configuration and run as desired. Depending on the size of the target set and the intrusiveness of the scan, it can take from minutes to hours to complete. Each scan is divided within 3 phases: scanning, enumeration, and vulnerability detection. Risks associated with performing a vulnerability scan pertain mostly to the availability of target systems. When performing a scan on critical systems and production systems, extra caution should be exercised, and the scan should be performed after hours when the traffic to the target is minimal in order to avoid overload. Having qualified staff members configuring, performing, and analyzing the results of the vulnerability scan is important. After interpreting the results, information security staff should prioritize the mitigation of each vulnerability detected and work with IT staff in order to communicate mitigation actions. The information security staff and IT staff need to communicate and work closely together in the vulnerability mitigation phase in order to make the process successful and fast. A hospital's risk management is a structured process involving identifying, assessing, and mitigating threats to the safety of patients, employees, and assets within a healthcare institution. It goes beyond merely predicting risks, and it involves creating proactive strategies to address them. Common areas of focus in hospital risk management analysis includes patient safety, medication errors, surgical complications, falls, wrong site surgery, infections, communication breakdowns. It also includes clinical practice, which includes diagnostic errors, inappropriate treatment, delays in care, lack of informed consent. Staff safety, which includes work injuries, exposure to hazardous materials, knee stick injuries. Information security, which includes data breaches, unauthorized access to patient records, cyber attacks, and compliance with regulations, which refers to the adherence to Joint Commission standards like HIPAA regulations and other applicable laws. The benefit of a comprehensive hospital risk management analysis is that it improves patient safety, reduces liability, enhances quality of care, and has efficient resource allocations. Prioritizing risks allows for targeted interventions and optimal use of resources. To ensure that information is secure, the following would need to be applied. Confidentiality. It will ensure that the information is not disclosed to unauthorized users. By implementing remote access controls, role-based access controls ensures that only authorized users have access to sensitive information based on their job functions. Integrity will allow Augusta Medical Hospital to safeguard data and ensure it will not be deleted or destroyed during transmission or backup phase and is secured against unauthorized access. Availability will ensure only authorized users have timely access to services and other resources and will improve the security protection of data to help against cybersecurity threats. Authenticity will help with security measures to validate the data's transmission from authorized users to its destination and confirm the message was delivered to the right person. Legal and regulatory standards significantly impacts a system by establishing clear guidelines and constraints, which can influence its design, operations, and overall behavior, often aiming to protect consumers, ensure safety, promote ethical practices, and mitigate risks within a specific industry or sector while also potentially impacting innovation, cost, structures, and operational efficiency, depending on the nature of the standards involved. By setting safety and quality standards, regulations can mitigate risks associated with the system, such as potential harm to users, environmental damage, or data breaches. An organization incorporates privacy principles by clearly stating the purpose for collecting data, only gathering information necessary for that purpose, obtaining informed consent from individuals before collecting data, limiting data disclosure to authorized parties and only when required, and implementing a defined retention policy to securely store data for a limited period, only accessing and using it when necessary. Privacy policies should have storage limitations. Implementing a data retention policy to define how long personal data is kept and regularly reviewed and deleted after it is no longer needed for the intended purposes. Purpose limitation, collecting data only for specific, explicitly stated purposes and not using it for any other unintended reason without further consent. Data minimization, only collecting the minimum amount of personal data necessary to achieve the intended purpose, avoiding excessive data collection. Consent, obtaining informed consent from individuals before collecting, using, or sharing their personal data, ensuring that consent is freely given, specific, and clearly understood. Additionally, it should have a transparency and notice, clearly informing individuals about what data is being collected, why it's being collected, and how it will be used through privacy policies and notices readily available to users. The challenges of data privacy include vulnerabilities in web application, insider threats, and poorly trained employees, lacking breach response, inadequate personal data disposal, lack of transparency in privacy policies, terms and agreement, and personal data sharing. Stakeholder engagement is the systematic identification, analysis, planning, and implementation of actions designed to influence stakeholders. A stakeholder engagement strategy identifies the needs of key groups, and the sponsor plays a vital role in ensuring those business needs are met. It helps understand the needs of stakeholders and how the organization plans and actions will benefit them. The benefit is to foster trust, confidence, and buy-in for the organization's initiatives, and the importance of a stakeholder engagement is to mitigate potential risks and conflicts to ensure that key stakeholders are aligned with the organization's strategic direction. NICT implementation process includes key stakeholders to ensure the program will run successfully. Those include Board of Directors, Strategic Committee, Chief Financial Officer, Legal Service Director, Information Security Director, IT Director, Human Resources Director, Customer Service Director, and Communication Director.